Good afternoon, everyone. Good afternoon, and welcome to our Leading with Passion second session for 2025. We're so excited to have you join us for our topic of men's health and how we can close the gap on empathy and close the gap on some of the data and some of the results that we're seeing around men's health as it relates to our panelists today. So, before I turn it over to Mike and our panelists, just wanted to share with you some of the statistics that are interesting regarding men's health. So,
And they say
and they're saying I'm not on video, and that's fine because I don't really need you all to see me at this point because I'm going to be out of the way here in a moment. So, as long as you can hear me, all good. So studies have shown that men are likely to go to the doctor, are less likely to go to the doctor than women. Only 60% of men are likely to go for their yearly checkups, and 40% won't go. And let's see if this is true for my men that are on, that they are until they're experiencing serious symptoms, and 20% simply go so that their spouse or significant other will stop nagging them. So, how many of you would raise your hand on that? All right. I see some hands going up. Absolutely. And we have to do that. The mortality rate for men, studies show 41% higher than women, with the leading cause of death being heart disease, cancer, and stroke. And those are serious issues. 31% of men suffer depression in their lifetime, and only 9% of men will actually talk about that depression and that anxiety. And we'll talk more about that data as it relates to our panelists. So we have Mike Radu, our CEO, who is going to be serving today as our host and moderator. And then, of course, thank you so much, Dr. Jerome Adams is with us. He is a member of our Absolute Care Board. I mean, his credentials go on forever, so I'm only going to give just a highlight. He's also a presidential fellow and executive director of health equity initiatives at Purdue University. And you all may not know this, but he was also our 20th U.S. Surgeon General. So we're going to have some phenomenal discussion between Mike and Dr. Adams, but also you recognize this face, Dr. Greg Fody. He's also our Chief Medical and Transformation Officer and the brainchild behind so many of our initiatives that we have. And you see our background, Beyond Medicine for All. We'll be talking about that as well as it relates to how we're impacting our members in our centers and in our communities. So before I turn it over, just want to, as I always do, give you all a background on what we'll be discussing. There'll be 3 segments of discussion addressing disparities around men's physical health. We'll talk about encouraging open conversation about mental health among men. And then also, how do we turn that advocacy for men's health into action? So how do we turn that around when it relates to us as individuals and organization and policymakers? Because that makes an impact upstream that affects us downstream. So let me remind you that you are in a webinar, so your phones are muted, but you can use your reactions, your chats. I'll be checking those as we go through the webinar. And so I'm going to get out of the way and turn this over to Mike Radu, who will lead the discussion. And thank you all for being on. Tap your neighbor, tell them we're live. All right, thank you. Mike, I give you the floor.
Thank you as always, Vivian. I'm so thrilled to have Dr. Adams and Dr. Fody, who we obviously call affectionately around here the Pod Father, and we'll call Dr. Adams the Surgeon General Adams. So a military commission.
I don't get a cool name like the Pod Father.
That's right, you will. You will when you reach your 12th anniversary with us, Dr. Adams. So yeah, very much looking forward to the conversation. I think there's some sobering statistics. I'll quote them, and then I think we'll sort of interject not only our intellectual side of our brain, but our own personal experiences. So as I was preparing, I was stunned to learn the life expectancy gap between men and women is higher than it's ever been post-COVID, 5.8 years. 90% of supercentenarians, which I didn't know what that meant, but that means people 110 years old. 90% of those folks are women worldwide. And there's a ton of statistics I think we'll talk later about men's disparity in preventive, whether it's flu shots, blood pressure checks, dental, cholesterol. My own little personal example is, Vivian, as you were surveying the panel as we were joining up here, I had or I guess I do have a congenital heart defect from birth, and I was treated since 7 or 8. Supposed to get annual checkups in my 30s, stopped going for 5 years. Finally went to the cardiologist, who wandered into the room and said, you need open heart surgery sort of immediately. So there are real health consequences for those of us that delay taking care of ourselves, whether it's prevention or otherwise. I will report to the board and otherwise in our insurance company that I'm in great physical health so far. So with that, maybe Dr. Adams, I'll turn to you. You know the statistics better than anyone around population differences. What are some of your greatest concerns about health disparities for men's physical health?
Well, I know that we're going to start off talking about physical health, but I do want to highlight that it is Suicide Prevention Awareness Month, and we do have 988, the new suicide crisis lifeline, available. And I don't want to miss a time to actually point that out, because whether it's someone who's listening to us or whether it's a family member or friend, we literally can save a life with 3 numbers. And so I want to highlight that, because as you mentioned in your opening, we know that mental health and physical health both are suffering. But I actually know that the numbers suggest that the disparities between outcomes for women and men are even greater for mental health than for physical health. But we do know that life expectancy is far lower for men than for women, and particularly so for men of color, for African Americans, for Native Americans, for Hispanics. And so we want to highlight that, particularly given the population that Absolute Care serves. But also one of the things I'm proud of in regards to this company is we try to do a really good job of making sure our providers are representative of the communities that we serve. That's a good thing for our patients, but that means that we are as at risk as in many cases our patients are in regards to these disparities. We know the mortality rate for men is 41% higher than for women. We know that men are less likely to go to the doctor than women. And Mike mentioned this, but I'm sure there are many of us on here, whether it's us directly or our fathers, our brothers, husbands, that know that have experienced how much harder it is to convince the males in your life to go in for care, but also to work around their busy schedules. And that's something else that we try to focus on at Absolute Care is really understanding those social drivers of health. And I think that's an important point here. Yeah. Is that these social drivers, these social determinants of health, in many cases are different for women and for men. And so when we think about the actual different outcomes that people suffer, we also have to understand that the challenges, the obstacles, the social drivers are different for men and for women. Sometimes it's cultural, sometimes it's practical and pragmatic and job related. Sometimes it's due to stigma. When we look at prostate cancer, and we look at again sexual issues, we know that there is a stigma there in many cases for men that goes beyond the stigma that exists for women in terms of getting tested and getting treated. And so we see that play out in different outcomes, whether it's a man who doesn't want to get a colonoscopy, or who doesn't want to go in and get his prostate checked, or who doesn't go in and get that sexually transmitted disease tested for, or get that HIV test. And so those are just some of the ways that we see physical ailments play out. And again, that's one of the things that I try to focus on in our board meetings for Absolute Care. And anytime I'm interacting with your clinic, some of you will remember that I've been out to several of the clinics, but just really understanding what are we doing to make sure we're creating an environment and opportunities where everyone, regardless of their race, their gender identity, their sexual orientation, feels like they can come in and get the care that they need and that they deserve easily and without stigma.
Dr. Adams, you touched on so many important topics. I know we're going to come back to some issues around mental health and mental wellness, as I think I have a background, hopefully behind me, related to 988, which is very much a passionate topic for me. You mentioned going beyond medicine. I think so much of what we're talking about today relates to people's beliefs and also sort of cultural biases and upbringing. And Greg, maybe I'll turn this to you as we sort of, I mean, the statistics are staggering about how many more women get vaccinated, whether it's flu or COVID, how many more men died from COVID and other preventable diseases. And then I think about the culture that many of us have been raised in, suck it up, be stoic, don't show your fears and your vulnerabilities, and sort of boy culture. Greg, you grew up as an athlete. Your son's an athlete. You've got a daughter too. Do you treat him differently because he's a boy and he's an athlete? When he gets the boo-boo, do you run it fast? Or do you say, hey, look, your leg hasn't fallen off yet. Get back out on the field. I don't know what it is in lacrosse, if it's a goal or a try, but whatever he's doing, he does it well. So maybe talk a little bit about some of the ways you're thinking about raising your young son relative to the way you were raised.
Yeah, no, it's a great question and it's very practical. So just share the way that I was raised. It was, I guess more the old school, which is actually how some people are still raised, is suck it up. Boys don't cry. Your leg hasn't fallen off yet. Get back in the game, etc. So when it comes to sports, I mean, I'm all about hustle. I'd rather you hustle than your skills. But in saying that, I really do try to hone in and know that there are cultural norms that really discourage men from being vulnerable, and as you both mentioned, really the stigma around seeking help. And so I realize I think that's even more so around men sometimes. And so when I interact with my son, I really do a lot of the times, like there was an instance where I had to cry a few weeks ago, and I cried, and I don't cry much, not because it's not a good thing, and it actually feels really good to cry. But he cried too. He saw me crying, and then he cried, and I really wanted to instill in him that it's actually stronger to cry than to suck it up and not cry, because it really builds up in your system. It has ramifications in your system, and so really do try to instill with him it's okay to cry. And I can tell sometimes when he's about to cry, and I really want to encourage that, because I do tell him it's stronger to cry than not to cry. And then I would say, and I say that to my to Lila too, but I feel like I do probably stress it a little bit more with him, just because he probably hears that out on the sports field a little bit more from others, that where I'm not always around. And when I grew up, my folks had 3 sons, and so we got it pretty tough on what it was to be old school tough, if you will. So I just want to make sure that he has the space to be himself, the space to cry. I also really instill with him that I want him to be able to call me for anything at all, no matter what is happening. I always let him know. In fact, he just got his first iPhone. I fought it forever. He's 11. He's at a new school. But anyway, I with that new cell phone, I said there's two reasons that you have that cell phone. One is so I can get in touch with you and know when to pick you up and things like that. But second, even more important, is that if you're stuck anywhere, or if you feel you're unsafe, or if you see your friends acting up in a way that you're not comfortable with, that you can call me. You can call me anytime. You're not going to get in trouble. I'd rather you call me if you're in a situation that isn't safe. And that's not exactly apples and apples, but I think it is creating a safe space for my son, to be himself, to have emotions, to reach out to me, and really just to have that space. So it's not a double standard, if you will, between my son and Lila necessarily, but just because of that old school cultural norm that's out there, I do stress it with him a little bit more.
Trying to be intentional on communication and vulnerability.
And I want to follow up on something that Greg said really quickly, because he talked, I appreciate you being really transparent and vulnerable in talking about the situation where you were crying in front of your son. But I want to add on to that, because that made me think about the importance of role modeling. And when we're talking about trying to improve men's health, one of the things that I think we need to do is talk about it, share our stories, role model. Hey, I'm going to get my flu shot and my COVID shot, which, by the way, everyone, I did last week. I posted about it on Twitter. Well, you don't have to post about it on Twitter, but share it in your own circles. I'm going to get my vaccines this year, so that it creates a habit. It creates a culture. It creates a normalness to us attending to our health, for our kids, but also for the other men around us. When I got my colonoscopy a few years ago, I made sure to talk about it publicly, again, to normalize that behavior. So just as we do that for our own kids, we want to do that for the other people in our life too. We want to share when we are investing in our health and are engaging in these habits, because other people, it may be the trigger, it may be the reminder, it may be the permission that they need to actually do these things themselves.
Yeah, Dr. Adams, you mentioned sort of the importance of individual leadership, is what I hear you saying. And then also you've dedicated your career to public health, both at the state of Indiana, leading there, and then obviously leading the United States, in some ways a model for the world. And so how do you think about programmatically, systematically? Is it men were just dumber, and so we just don't know these things? You mentioned some of the barriers, culturally or otherwise, that how do you think about activating men towards their health, and what can we do as a society? What can we do as Absolute Care? What can we do as communities, related to this challenge of barriers to preventive medicine, or frankly treatment?
Well, I alluded to this earlier, but we know that there are certain things that we have to do differently for our kids. So there are pediatricians. We know there are certain needs that women have. They in some cases they have their own doctors, OBGYNs, because they have certain needs. But I think what we lose sight of is that there are unique needs and barriers that men have. And so my advice would be to think about, be aware of those particular needs and barriers that men have. If you're talking to someone who speaks a different language, you need to have a translator in the room, or you need to recognize that they may speak a different language than what you do. And in many cases, that they've written whole books. Men are from Mars, women are from Venus. We literally do think differently, and speak a different language. And so understanding that, I think if you take nothing else away from the conversation today, it's understanding that we do need to, in many cases, customize the care that we deliver to men to help them overcome some of these cultural and stigma barriers. Again, in many cases, men don't want to talk about sexual health. They don't want to talk about a colonoscopy. And so you have to have a different conversation with them than you do with the women that come in. But in many cases, as I mentioned, there are also practical barriers. we live in a world for better or for worse, and everyone makes up their own mind about what kind of life they want to live. But where men tend to be in the workforce more than what women do, and so when we're talking to our men, we need to understand that their workplace may be and their work situation may be a barrier to them being able to seek care. And then Greg, you mentioned, well both of you, Greg and Mike, the idea of pull yourself up by your bootstraps. We gotta you gotta find different ways to connect with men. So it's like your car. Sometimes you got to go in and get your oil changed or get your tires rotated so you don't end up stranded on the side of the road. We need to help men understand the importance of prevention and not just reactive treatment by speaking to them in ways that they can understand. Another great way to have that conversation with some groups of men, because not all groups of men lean into sports, but you're seeing athletes like LeBron James and Tom Brady. Once upon a time, the quintessential sports figure was Babe Ruth. And I say this, knowing that Absolute Care actually, is headquartered in Baltimore, Maryland, the home of Babe Ruth. Well, Babe Ruth famously smoked cigars and ate bacon and eggs, for breakfast every day. That's no longer what we see as the ideal for a male athlete. It's now, LeBron James, who gets to sleep, and eats right. It's Tom Brady, who, and it's these guys who are really invested in their health as a sign of their manhood. And so I think leaning into that is a great way for us to help. And I haven't this is literally just a thought in my head, but we need to figure out, can we get posters of LeBron James and and Tom Brady working out and having them in our offices to highlight health, or them talking about their diets, and emphasizing that as a sign of manliness and not as a sign of again something that only the women think about.
Yeah, that's great points, and certainly if we had posters of LeBron and Tom working out, I think the women would be happier to see that too. So that works for a variety of different folks. And I think part of the theme here is creating safe space for folks, men in particular, to experience vulnerability from others and then express what's locked up inside all of us, not even many of us, all of us. And so I think about a colleague, some of you may know Chris Goldsmith, who is with us still working, actually, but on leave. So I guess I shouldn't say working, who is experiencing cancer and has been, in my mind, shockingly transparent with his condition, including using business platforms like LinkedIn, which are normally meant to convey upward progression and business success and strength. And here he is talking about his cancer and the struggles that he's experiencing personally and with the system. So I think that's a great model as well for us, a good example, as painful personally as that is for him, that lesson. But Greg, I'll turn it back to you. Dr. Adams gave us some poster advice, but how do you think about Absolute Care, and what can we do in terms of bringing out this topic more, both for ourselves as teammates, but also for our members as well? Where do you lean in terms of this?
Yeah, I mean, I think we have a lot of things in place now. We certainly can add more in the future. So let's talk about the why of Absolute Care, and then what we have in place now. And yeah, I think one of the problems that we have today is with men, that really is delayed engagement with healthcare.
Yep.
And then the second thing is really access to interventions around social determinants of health, food and other things, and healthy food, et cetera. And then with that, I want to say that at Absolute Care, we specialize in marginalized, complex populations. And we have those populations, many times there isn't access to care or access to immediate care. It's hard to find care. I mean, Mike, you talked about trying to find your primary care provider, right? And you have really nice insurance. I try to actually get mine, and I'm struggling to find a primary care provider. So at Absolute Care, access is essential, and we try to have best in market, leading market access to care. And so if you call and you want an appointment, you get an appointment. If you call a same day, you're seen. If you're not feeling well, and we don't want you to wait until you're not feeling well, if you're not feeling well, you can walk in and really be seen, which I think is incredibly important, because I know for a fact this population didn't have that in the past. And so, yeah, if you look at the analysis of pre-Absolute Care with Absolute Care, over 70% of the population pre-Absolute Care, including the men, were seeing their primary care provider 0 to 2 times in 1 year. And with all those complex needs, it has to be higher frequency. And the reason it's not higher frequency is because primary care access is lacking. Many primary care providers aren't taking Medicaid, and there's long waits to get in. So I think that's number one for me. And we can always lean into more access over time. I know we talk about access all the time. Second is how we engage our members, right? I'm not talking about, I think we really go out. I think some offices sit there and wait for people to come to them. But we go out and we really try to proactively engage members and our population. And we're going out into the streets. We're talking to the member about the access and the care and the great care that we have. Unfortunately, we do meet some of our members when they are admitted, but we're trying to prevent readmissions if we're trying to get in front of it. And so really how we engage that population. Secondly, under how we engage the population, once we are able to find a member, and I think it is really about the respect, the special respect that our members get here. The population and many of the men, I know that for sure, that we work with have lost trust in the system in general, and certainly lost trust. They don't trust the healthcare system. And the fact that we really do slow down, we're able to listen to their stories, we're able to give them the respect. And I feel strongly about this, that this is really the cornerstone of our model, is that respect that we give our members, and really the ability to build trust. And if you give respect and you build trust, and actually you lead with empathy, and you start, as Jerome was saying, you start sharing stories about yourself as well, that allows our members to really feel safe and give them a safe place to open up and share their stories as well, about what's important to them. And then we continue to build trust. And as we continue to build trust, then it only at that point when we build trust here at Absolute Care, I think that's when we start weaving in the real clinical medical interventions, because the members that we take care of, the men that we take care of, they've interacted with a handful of white coats, mostly in acute care, right? But not primary care. And we need to really separate ourselves. You've heard me say this in the past. Take off your stiff white coat and stay a while and listen, because they've seen a lot of white coats, and sometimes that wasn't the issue. Really, the issue was that the adverse social determinants of health, the mental health, et cetera, and the fact that we do have the interventions to really address the gaps that they have in their life. And when they do trust us, they're willing to share those gaps, and then we can weave in our interventions, which I think are so critically important. I guess I don't know if I'm on number 3, 4, or 5 right now, but finally at 6. Yeah, thanks. I do think it's really important to have a strong population health management approach that I do believe many of our members get lost in the shuffle, right? So if you go see a doctor and you don't make a follow-up appointment with them, how many of those reach back out to you proactively? We have rosters, we have reports on men with uncontrolled blood pressure, our quality reports. We really want to engage our population. And so we proactively reach back out to the members and talk to them and remind them about how important and that we want to see them again. So I do think that's something that we do that is special here at Absolute Care that others don't do, and we do it quite well. And then finally, I do think so in the future, I love the idea of more marketing material, really about others who did have that test done, who did have that COVID vaccine done, who did get their colonoscopy done. I do think it's really important, and I love that idea to really market other role models that have gotten that done. And something that I do when I used to see a lot of members, I don't now, as you most know, but when I did, I shared with them about myself and how vulnerable I am, and that I would start with my story and tell them about, because we all have a cross to bear. And so as you start sharing with them, they're able to open up as well. And so I think all these things are very special at Absolute Care and what we do. And again, building trust. If you build trust, members want to come back to you, create that access where it's easy to come back to you. And then we're able to do those tests and talk to them about preventative care or chronic care in order to improve outcomes. I'll give you one more thing specifically. So speaking of men and they have a higher, and speaking of African American men, Hispanic men, Native Americans, the majority of population that we see are African American and Latino population or Hispanic population. And so the hypertension rate of that population is large. There's a large percentage of those members. One thing that we track as an organization very closely is hypertension control. I want to say that pre-Absolute Care, the hypertension control of the population that we take care of as they enter into Absolute Care is about in the 25th percentile, which means there's a tremendous amount of men and women walking around out there with uncontrolled blood pressure. Working with Absolute Care over a year, we get it up to the 90th percentile. So think about that. And I think about a marginalized, and that in my mind is a marginalized population where they were not receiving the care that they needed, and that resulted in uncontrolled hypertension. We all know what hypertension leads to. Hypertension leads to chronic kidney issues. It leads to strokes. It leads to heart attacks, etc. So I just want to say that the fact that we get it up to the 90th percentile because of everything that I just mentioned. Think about how many strokes we avoided, how many heart attacks we avoided, how many kidneys that we saved over time. And that not only affects the member and improves their life, if they're taking care of a child, if they would have had a stroke and weren't able to take care of that child anymore, it really does have a generational effect. The work that we do on the next generation, and back to role model, that if someone's son is seeing maybe their father or their grandfather accessing care and they got their blood pressure under control, it can really affect the next generation in many ways. So that's one of many reasons that I'm proud of what we do here at Absolute Care.
Yeah, I'm so glad you said that. Just really quickly, I mean, you're right. We need to reach men where they are. We need to go out to where they are. We need to create time and space. One of the things you mentioned, when you think back particularly to Black men, they were the subjects of the Tuskegee studies. And so, that there is a long and understandable amount of mistrust and distrust with the medical establishment. We can't just go in and start talking about health. We have to go in and create space to start that relationship. And sometimes it's asking them, what what brought you in today? What concerns do you have? What are you worried about? And giving them that space to be able to talk about it. I've walked through downtown Baltimore and talked to people, and let's be honest, there are a lot of conspiracy theories about what the healthcare system wants to do to you or is doing to you. And so we have to acknowledge that we're coming in not from a neutral starting point. We're starting in from a trust deficit with these folks. And as I mentioned earlier, many women actually, whether they want to or plans to or not, are forced early on to figure out how they're going to deal with the medical system because they have babies and because they have to go to the hospital to have their babies. You can have men who are 40, 50 years old, quite frankly, and have never been forced to go in to see a doctor for any reason. So in many cases, we are the first time that they've ever gone in, and the other thing is when you're going in for a baby, that's a happy reason in many cases. Men, when they go in to see the doctor, it's usually when something's wrong, when they're scared. And so it's a very different dynamic, and we have to understand and respect that. And there are ways we can overcome it, and Absolute Care is doing that. But you can't overcome it if you don't understand that trust deficit that you're operating from the start.
I think it's powerful from both of you. And Greg, as you mentioned, sort of from an Absolute Care perspective, creating instant access so that when we do activate men towards their health, they have a place to go and quickly. And you also mentioned the system of nudging. So those reminders, because I think all of us as men have neglected to follow up on standard treatment. And then obviously thinking both Jerome and Greg, you both talked about sort of stigma and bias. I'm sort of even thinking about there's an actress, Olivia Munn, there's Angelina Jolie, that have talked about women's health. They've had breast cancer issues. They're very, very public. Not many actors are talking about prostate cancer. And then I got my prostate exam. And so just trying to think about role models personally. Greg, you mentioned that. Jerome, you've talked about role models more culturally, and then addressing the stigma and bias related to sexual health and others for men in particular. I think are all really, really powerful statements. I want to pivot a little bit, not a lot, a little bit to Jerome, sort of where you started this conversation. So as I was doing research for this talk, came across the phrase, the death of despair, and thinking about the longevity gap between men and women, 5.8 years, biggest it's been post-COVID, and the incidents that are driving that difference. Why are women living so much longer? Why are men dying too early? Certainly COVID was a part of that, as we said earlier, but also these other aspects of likely to die of overdose, of accidents, of suicide. A silly example, and I'll get to a more serious one. When I was married in my younger years and applied for renewed my insurance, the minute I got married, my insurance dropped. And I asked my wife, why is that? And she said, because you now have adult supervision. So men are more likely biologically or culturally to do more risky behaviors, as well as experience suicide, depression, and others at a higher incidence and go untreated. So Jerome, you started us off there. How do you think about this issue of men and how we not only delay preventive physical treatment, we are reluctant to seek help for mental illness, depression, and our own well-being?
Well, again, not to lean too much into sports, because that's some people are sports fans and some people aren't. But I've been really heartened lately by so many sports figures talking about mental health. By the I'm in Indiana right now, and Indianapolis has a Kick the Stigma campaign for the Colts. You've got Kevin Love, a basketball player, talking about mental health issues. I actually did an interview, a podcast with Charles Haley, former Dallas Cowboy Hall of Famer, where he talked about his bipolar disorder and his self-medication and substance misuse. The more we talk about these issues, the more we normalize them. But traditionally, mental health hasn't been seen as a type of health. Um, it's been for men very much an acute situation. Deal with a problem when it occurs, and only if it's severe enough to stop you from in your tracks from doing the other things that you're supposed to be doing, whether that's playing sports or going to work, to much more of a proactive, let's stay healthy and strong in the first place. And NFL and sports, NFL, NBA, again, Olympics. You saw a lot of conversation about mental health during the Olympics. It's changing the narrative to number one, recognizing mental health issues. So diagnosis and treatment, but then self-care and prevention, I think, are important aspects of this. And so, from a positive perspective, I'm seeing the narrative change, not fast enough, but it is changing, and we need to understand and embrace that and normalize conversations about mental health. And it goes back to what Greg said earlier. And we need to normalize those conversations with our own kids. Having conversations about how are you feeling today, and helping them learn to talk about their feelings, and helping them understand that it's okay to have feelings and to express them.
Yeah, I think that's so critical. Greg, you at a management meeting, speaking of feelings and vulnerability, you were really vulnerable with a team of leaders a couple of years back, talking about some of your own personal struggles and anxiety related to how you interact with the world. And I just wondered if you wanted to kind of share a personal story to kind of talk about your own. I'm sure there was a mental health journey, related to that as you were growing up and being very successful in the world, bringing that with you.
Thanks. It's not easy to talk about, but yeah, happy to share with the team. I love this team. Since I was born, or since I can remember, and as I get older, I can't remember that far back, but anyway, I've always struggled with a stutter. If you talk to me long enough, I have a stutter. I've been working on it my whole life. It was a very bad stutter when I was a child in high school, or in elementary school. It was pretty bad. In high school, it was really bad. And you can imagine, it was interesting because I did play lacrosse and soccer, and so I was part of that team and whatever, but having a stutter and having to get up and do presentations, etc. I mean, you're talking all the time and your mind's always thinking about talking. And so getting made fun of, and just the anxiety was overwhelming. It was overwhelming. It was so overwhelming that I actually have failed classes before I would skip classes because I didn't want to go do that presentation in front of the group. And I'm not alone in that. There's 2% of the population suffer from stuttering. But anyway, long story, I guess, longer. It creates a lot of anxiety. I every day in my life right now, I have anxiety about it. But I've worked through it. And I think the important part of it is, many years ago, I felt like I guess I wasn't strong enough, or I was weak, or I don't know what the word was, but I didn't, I mean, my parents took me to speech therapy, but I didn't go to talk to anybody about it. But when I went to go talk to somebody about it, it's always just a relief, right? To go talk to somebody about something and just let it out. And so I've worked on it over my years, getting out there, talking. I remember that, my high school friends who, again, they have one vision of me, and now I have the new chapter of me. But I told them I was going to go to med school, and they were looking at me like I was nuts. Like, you can't even say the words, right? There's tough words in medical school. You can't say those words. And so just dealing through all that, and overwhelming anxiety leads to depression over time. And so, it's been a roller coaster ride for myself. And I'll share, there's not one day today that I don't, it's always there, and I'm always thinking about it. But the fact that I did go seek to talk to somebody about it and regularly speak to somebody about it, and then Yeah, and then also talking to other folks that do have the same thing and stutter, and so I just say that because normalize it, right? I'm not the only one out there, and so yeah, it's important to me to it's important to me to talk about it. It took a lot. I think it was 3 years ago when I got in front of the management team and talked about it. That was the first time, and everyone knows it. I mean, you can't hide it. It was the first time in my life at work in front of a new boss, a management team that I got up there and
Yeah.
talked about it, and it was cathartic. It was very helpful, and so again, not apples and oranges, but I do think about um, the population that we take care of. They were born sometimes. What I think they were born onto a zip code that they couldn't change, and they were born onto a zip code that were a lot of adverse social determinants of health, and maybe had an adverse childhood event which led to things, and they couldn't. It was done to them necessarily, right? Like they couldn't change it, and I couldn't change this, and so I again, it's apples and oranges. I don't want to say that I was born in not such a nice. I was born in a nice zip code. Um, but I do realize that when I talk to our members, that they have something that is really tough to get out of that web, and they were born with something, and so that helps me really relate and have sympathy and empathy for the members that we work with. And anyway, I think it's important. It helped me relate to some of our members because really feeling the heart of the matter of when you're really struggling with something and it's hurt you and you have anxiety about it, but then you're able to share that with somebody else. And I would share that with some of our members, and it it would really have us relate. So I'd say that if any of our teammates are struggling with anything or have any anxiety, or again, and that's why I really think everyone has their cross to bear. I really do think that. I encourage you all to seek somebody to talk to, and then have our members talk to somebody as well.
Yeah, that was amazing. And thank you again for sharing that story. And by the way, you gave me permission to ask you that question. So folks are wondering about that, but I really appreciate your courage. And you mentioned that everybody is dealing with those their own cross to bear. You mentioned that a couple times. I'm thinking about the most popular cartoon after World War II was Superman. And that's the metaphor that young
Yep.
boys are taught to
Yep.
emulate. So Jerome, maybe turning to you, as I know this is rapidly, we're losing minutes here. Thinking about allies, we have a number of allies here. An ally could be obviously the women in our lives, but it also could be another male friend who, and you're going with something and they don't know it, and all they're talking about is Vikings football, which I don't really want to talk about football right now with the Rams. But anyway, for UCLA Bruins, but let's not quibble. Jerome, how do you think about allyship and the role of in some ways all of us to support each other, but women first and maybe more generally second?
Well, one of the things that I would say is that there are a couple of interesting correlates that we haven't talked about yet that kind of dovetail into allyship. And that's that when you look at the difference between life expectancy between men and women, a lot of that is correlated to social connectivity. We know that women are more likely to have friends, multiple friends who they can call on, who they lean on, and that your life expectancy is actually directly correlated to the number of people who you feel you can pick up and call on the phone and talk to, or who you talk to on a regular basis. We also know that many of the opportunities for men to come together have decreased over the years. So men used to have, there's a book called Bowling Alone. Men used to get together in bowling clubs and in social clubs, and we're losing that connectivity. So for me, to answer your question, allyship really starts with trying to help the men in our lives develop social connectivity. that social connective tissue. Whether you're a male friend of another male, creating opportunities for them to reach out to you, and vice versa, or if you're a female. And my wife really tries to help me with this. She tries to help encourage me to
Yeah.
make plans to go out with someone, with my buddies, or to plan vacations. My wife and her girlfriends, they plan trips regularly. They're always doing stuff.
Yeah.
But with guys, it's all, there never seems like it rarely seems like there's someone who takes the initiative, or the opportunity. And so I think it seems small, and it doesn't necessarily seem like something we'd be talking about in a medical conversation, but it is literally one of the biggest correlates, because it's where everything else starts. Once you're getting together with the guys, then you start talking about, oh, I got to go get my prostate checked, or I got my colonoscopy, and you start talking about the things that are bothering you in your life from a mental health standpoint, and you realize that you're not alone, and you can help better take care of yourself when you have a good support system around you. So that's the one thing that I would say, for first and foremost. And then, as I mentioned before, role modeling, sharing, talking about your own health journey helps create a culture and permission for other people to go on their own health journeys, because they don't feel like they're doing it alone. They feel like they're doing it as part of a bigger group of people who are focused on their health.
No, I think that's so important. In some ways, socialization is sort of the vaccine equivalent, right? In terms of just preventing so many terrible things. And then, as we get together with our buddies, we spend more time diagnosing defenses than we do each other, and sort of what's going on in our lives. So I really appreciate that advice about making sure that we talk about our feelings, that we make time for each other. Really, really critical. Well, before I thank you, I just want to share my own personal story in the context of, I think, the banner behind me. I had my own coming out journey about 3 years ago with my brother, who many of you, but not all of you, know. I had, or have had, a identical twin brother that I lost to suicide about 5 years ago. Many of the things we're talking about today impacted his life. Very successful banker, high-powered MBA, well off, but started to become more socially isolated as I moved away. Got married, had kids. He didn't. He let his friend group wither, Jerome. So that's social isolation. And then started to abuse alcohol as he had problems sleeping and dealing with his anxiety and other issues. He was depressed. And then one dark night at 2:32 in the morning, we lost him. And so as Dr. Adams started this conversation, the stats are stunning. I don't believe them. 1.3 million have a plan for suicide. 3.5 million, actually 13 million actually consider suicide. 3.5 million have a plan.
Yeah.
Stunning statistics. We lost more people to suicide last year, almost 50,000 than ever in the history of the country. And there could be folks here on this video call that have thought about this and struggled. There are certainly folks here that know that folks in our social circle are struggling and are vulnerable. And I would just ask you to lower the bar. If there's anything here to talk about vulnerability, is reaching out to people, checking in with them. Even now I have friends in DC that I've met and don't know about my brother. When they find out, they're reluctant to talk to me about it. I don't mind talking about my brother. I love my brother. And so lowering that bar, as Dr. Adams said, of engaging, whether it's 988 or other avenues, or you taking that on personal responsibility to reach out with a chat and inviting. And for those of you that are ever thinking about this, just know, please, your friends and family want you in this world. They want a call from you at 2:30 in the morning. They will not mind. Trust me, they love you. And with that, Dr. Adams, Dr. Foti, thank you so much for this discussion. I learn something every time we do one of these. Very much appreciate your time and sharing your vulnerability and your insights with the rest of our team. Thank you so much.
Thanks for the opportunity. I appreciate it. And everyone, again, Suicide Prevention Awareness Month. Remember 988. Those three numbers could save the life of someone you deeply care about.
Thank you.